If you're age 64 and just coming up on Social Security and Medicare, you're going to want to hear this. So when facing Medicare sign-up, you need to get some education on the 4 parts of Medicare. This is just crucial, and to go into this and make a decision about a plan before you really understand the federal program, it doesn't make sense. So Part A of Medicare is your hospital and skilled nursing, and you don't have to pay a monthly premium for that. It just, when you're turning 65 and you become 65, you get it, no monthly premium, and it's going to cover your hospital bills very well. Part B is pretty much everything that's not in the hospital, doctors, outpatient, everything but prescriptions, and it's your doctor and outpatient, and you do have to pay a monthly premium, $135.50 a month. And if you're a high-income person, you have this pesky IRMA to deal with, and we can get into that. If you give us a call, we can provide you some consulting on that, but that's an increase in your monthly cost for your Part B. Part C is just really another way to receive your Medicare, and it's one of these Medicare Advantage plans, and you're receiving your hospital and doctor coverage or your hospital and medical coverage through a private insurance company like United Healthcare, Humana, Aetna. And if this is something like you're interested in, we can provide you with both the education and get you signed up in something like this. And then Part D is your drug plan in prescription drugs. And you do pay a small premium for this, and you don't sign up with this through the government. You do it through somebody like me, and you can purchase a plan that's going to cover your drugs. So for people going on Medicare, they really need to decide which route they're going to do all 4 of these things. But what I want to tell you is what most of our customers do is they sign up for A, they sign up for B, they sign up for a D plan through us, and they purchase a Plan G Medicare supplement, which is going to pay your deductibles and co-payments and just provide you umbrella insurance for the stuff Medicare doesn't pay for. Now, within Medicare supplement, it's important that you learn about open enrollment. And that's going to be a special period that's right in front of you folks that are listening. And you've got a window of time where, regardless of your health, so you could have diabetes, you could have kidney dialysis, you could have cancer, you could have just about anything that's serious where you're thinking you can't buy insurance, you're guaranteed from the government that you can buy insurance. Not only can you buy it, every single company that offers Medicare supplements in your state has to charge you the same premium and charge the same premium as completely healthy people. So this is real important for everybody, especially people with pre-existing conditions. Now, when you get into the actual Medicare supplements, I'm just trying to simplify this. There's actually 10 lettered plans available. They're standardized, dictated by the government. These are the plans you can offer, Mr. and Mrs. Insurance Company, and it needs to be exactly like this. And then you need to call them this. The government did this so you can price shop. And what I want to share with you is don't buy this stuff from the first person that you think is real nice that comes by to see you, because you need to shop for this stuff because the prices vary widely. I've put up an example of about $100 a month for somebody turning 65. Is about what a G plan should cost you. But if you live in an expensive state like New York or Florida or maybe Connecticut, you're going to pay substantially more than this. But by and large, this is a good number to work with. Now, I pulled up an example right here at the zip code where our office is in Durham, North Carolina, and I got a female who's married, who is in this zip code, and we plugged it all in, and it has a low of $83 a month for a Plan G, and all the companies in between are on this thing, and you go to the most expensive, it's $212 a month, selling exactly the same thing, $83 a month to $212 a month. So you go figure. We represent most of the companies on this sheet and can enroll you in one of these plans when it's time to do that, really just over the phone. So this business of having to come out to your house or meet you here in the office, it's certainly not necessary anymore. Okay, and there's 3 states that don't call them Plan Gs and Plan Ns. They have something very similar, and they're listed right there. Okay, now we want to talk about Social Security for a minute. You say, well, why are we talking about Social Security? I thought this was about Medicare. Well, you actually sign up for Social Security you sign up for Medicare through the Social Security website, ssa.gov. And, you know, when you're getting your Medicare, you've got Social Security decisions run of you. So, some of you may already be on Social Security. What I'm going to tell you is the first thing you need to learn is you need to learn this FRA, or full retirement age, is what is your date where you're eligible for full retirement. And for people born in 1954, that's age 66. 1955, that's 66 and 2 months. Okay? And so if you don't want to take your Social Security check prior to this age or prior to full retirement age, because you're going to end up having to, if you're still working, because then you're going to have to give some of it back at the end of the year. So this is going to be the earliest for people that are still working. Now, the magic date is somewhere between 62 and 70. You can start Social Security as early as 62, and you're going to get a lot less than full retirement age. You can start it as late as age 70. You're going to get substantially more than you would have at full retirement age. Now, your spouse figures into this equation as well. And so if your current spouse has a very high earnings record, you could possibly get more benefit by filing on their thing. If you're divorced, you're single now, but you were married to a person for more than 10 years, you may get more benefits by filing on their record. And if your spouse is deceased, if you're a widow or widower, and the same thing, you can get substantially more, possibly, of benefits off of their Social Security earnings history. So that's very important to know. Now, this third area that we're talking about here is really long-term care and long-term care insurance. And I'm just going to say a couple words about that. One is it says right in your Social Security statement, and I'm going to recommend you get one of these things if we do Social Security planning for you, or we help you picking your age. If you go to page 4, it mentions long-term care. It says Medicare does not pay for long-term care, so you may want to consider your options for private insurance. I mean, it's just basically coming from the government and the Social Security Administration is don't look for Medicare to pay these bills. And what I'm going to share with you, having done this for a long time, is the reason that people buy long-term care insurance is because they love their family and they don't want their family to go through the consequences that they're going to endure having to provide for your care. I mean, a son and daughter might have to quit their job to take care of you, and it can make an elderly spouse, actually you end up with 2 sick people taken care of. So what I said at the beginning of the video is I talked about you need to get yourself educated on these subjects. And I'm going to share with you that I wrote it and published, and they're on Amazon, a couple of books that have a chapter on each one of these things we've talked about today. You can go to our website. You can get the chapters of those books at no cost. You can just download them. We have them all up there. You can give us a call. A lot of people are surprised that you can talk to me if you'd like to. This is our phone number. We also have a radio show every Saturday morning at 8 o'clock. It's only on in the Carolinas and the cities, but it is immediately put up on a podcast called Finishing Well. And every week we put out a 30-minute segment on one of the chapters of the book. So we handle solutions for these in all 50 states and the District of Columbia. We'd be glad to help you. I'm Hans Scheil, and thank you for listening.